Hello guys, Dr. Ina and Dr. Maha here today to talk, discuss, ask questions, ask comments about the somatic integrative approach for our patients. So I'm going to give a word to Dr. Maha, who is working in the clinic by providing that type of service. It's a very unique service and it's a very interesting service. Not a lot of doctors actually offer that. So I consider that extremely valuable for people who are suffering from depression, anxiety, post-traumatic disorder, or not even suffering, but experience certain worries in life and cannot handle it on their own and they need help. I believe she's the one who can help you without using medications, chemicals, and other ingredients that give some negative side effects. So please, Dr. Maya.
Okay, thank you, Dr. Ina. So I think it's important to understand that this is not for people with a diagnosis, right? It doesn't have to be you're diagnosed with PTSD or with anxiety or with whatever. Some people come, they just have no motivation. They struggle with relationships or with career, or they struggle with fears that they don't understand where they're coming from. Anything that make people or a person feel limited in living their life to their full potential. And actually, those people are the most lost because modern psychiatry and even therapy usually focuses either on pharmaceuticals, which are, geared towards diagnoses like depression, schizophrenia or bipolar. Like there's no real room for people who are just not feeling that they are on the top of their game in life. And talk therapy has its role, but unfortunately, if people have tried it, there is a limited value and it doesn't help everyone. So one of the things that got me interested in this is that I'm originally an internal medicine specialist and I was primary care. And I could see there's a lot of people who come with these, like, they just don't feel well, but they don't fit a certain criteria. And they're missing out on life, or they're not capable of fulfilling their dreams or having good relationships or anything like that. So I looked into it and I found that there are core problems that we have as we grow up. Now, somebody from the outside would look like, well, they had a normal childhood. They didn't have, disasters in their lives, so they should be fine. But that's not the case. We have traumas that don't fall under the definition of a major trauma. Loss of a loved one when we were young, or having problems in school, or siblings, or even moving, or poverty, or violence, and the list is very long. So these issues become like the gravity where the personality forms around, and these issues come up later in life with perceptions of life, reactions to life, even a view of life. People don't know, for instance, they carry a view about life related to them not feeling safe when they were little, and they carried that forward, that life is not safe. And that's not little, because if you feel life is not safe, it will affect your relationships, it will affect your choices, it will affect your career, what you do, because there is this, the operating system belief that life is not safe. And there's so many examples of that. So what we do here, because we have this philosophy, me and Dr. Ina, that we don't just, put Band-Aid and, okay, you don't feel good, here's a drug, or here's, go do that and feel better. My work is I combine some talk therapy with regression therapy, and the regression mostly childhood and past memories. It could go back to past lives. Sometimes it doesn't. We can call also light hypnosis, and also very important somatic therapy, which is very important because the body keeps the score, as a famous book says. It it holds on to emotions that were experienced for a long time. And we need to put the body in the picture of the healing, let go, because it's held in the nervous system, by activating the vagus nerve and letting the body complete the movement it needed to complete years ago.
All right, so giving my own testimonial about Dr. Maya's work, I am her patient, and I truly enjoyed, and it became clear to me that integrating talk, professional talk, finding the root cause during the conversation made a huge difference. But involving the body into that talk and actually finding blocks in the body made such a huge difference and made the release of certain fears, emotions, excitements, and other moods that we're going through when the integrative work happens, made a huge difference and made me more confident in realizing what mistakes I've done and what do I need to fix it. Because it's not only about letting things go. It's always also very important is to realize what mistake you've done, maybe years ago, or what conditions life put you in, and easily let it go. Not through stress, not through tears, not through force, but with ease. And that's what the integrative somatic approach gives you. Talk, because she's a doctor, so she knows how to diagnose, how to get into the root cause, okay? And plus the techniques that somatic therapy gives us in terms of the tapping, in terms of the shaking of the body, in terms of what else you do, hypnosis, like, go into that, like, not heavy hypnosis, but into that trance, light trance, where you just letting mind do its work. So yes, there are a lot of integrative therapists out there, but they're not doctors. They're not diagnosing. They don't have that skill and ability to do that with the integrative therapy. So I believe that it's a wonderful option here in the clinic that you able to do it, and you're able to do it without any preparation. It's not like a diagnostic test where you need to fast or you need to come at a certain time. For those patients who are candidates, Dr. Maya also recommends ketamine IV, because certain patients do require a chemical approach as well. And since she's able to do so for some patients it will be a lot useful as well. So I haven't done it with ketamine. I've just done integrative approach, somatic approach with talk, and I'm truly fascinated by this work, and I will continue doing it and recommending to even teenagers, because teenagers nowadays are, I could say, in trouble. Why in trouble? Because life is so hectic and the social media is so busy with putting pressure on them, how to look, how to behave, how much to weigh, what to wear. So teenagers need support, and sometimes support from the parents doesn't help. So professional support is needed, but without chemicals or drugs. So, it's a long testimonial, but I really want to share with people more and more, because that's a working mechanism for sure. And you guys should try it, and you shouldn't be questioning or scared, oh my God, I'm going to open up to someone, or I'm going to be vulnerable. It's okay, because if you deal with professional, first of all, your vulnerability will stay in the room. It's very confidential. So you shouldn't worry about that. And not a lot of professionals actually combine that method. So I don't think you should continue living with your anxieties or post-traumatic stress disorder. You should take it into your hands and get rid of it as soon as possible.
Yeah, that's why we're here.
Yes. And so, yeah, if you have any questions to Dr. Maya, please, you can email us, you can comment below, you can follow the Instagram, and if you guys are interested, I wanted to ask you, Dr. Maya, is it possible to do remote sessions? Or yes.
Yeah, absolutely.
So distance is not an option.
No.
If, let's say, you're in a different state or different country,
we can do it.
Remote treatments also has a place to be, and so it shouldn't be just in the clinic.
That's true, yeah.
Thank you.